हेलो। हेलो।
So we can hear you now.
या हाँ हाँ।
Yes, sir. So we are starting, sir.
या सर। हेलो। हेलो। कैन यू हियर मी?
Yes, sir. We can hear you. So we are starting, sir.
या।
Hello and good evening, everyone. I am Nancy from the marketing team, and I have with me Kritika. Together, we will be moderating the session today. On behalf of Elsevier India, I welcome you all to this wonderful session on choking versus cafe, coronary, and reflex vagal inhibition of the heart by Dr. S. Chand. Please note that you will be on mute by default during this webinar. If you have any questions from the author, you can put them in the Q&A section. All questions and queries will be addressed by the author at the end of the webinar. Participants joining us on Facebook can add their questions in the comment section. I would like to introduce Dr. S. Chand and invite him to shed some light on the topic. Dr. S. Chand did his MBBS and MD in forensic medicine from Maulana Azad Medical College and is associated LNGP and GP Pant Hospitals, Delhi. He began his career in 2013 as assistant professor in Rama Medical College, Hapur. He has worked as an assistant professor in Rajshri Medical Research Institute, Bareilly, and as professor GS Medical College, Hapur. He is presently working as a professor and head in the Department of Forensic Medicine and Toxicology at Teerthankar Mahaveer Medical College and Research Center, which is in Moradabad. He is the life member of Indian Academy of Forensic Medicine and Punjab Academy of Forensic Medicine and Toxicology. I would now hand it over to you, sir.
Yeah, please change the slide. Yes. Hello, everybody. I welcome all students. This is a session on the topic of choking, cafe coronary, and reflex vagal inhibition of heart. So we will address some basic issues regarding these things, right? So first of all, choking. You might have heard many times that a small child that ingested something, but just after ingesting something, he started breathing difficulty and he holds his neck, right? In such situations, what do we see? That child that starts for oxygen, right? This condition that is commonly known as choking, right? So we can define choking. It is a form of asphyxia or suffocation caused by obstruction in the air passages, especially at or just below the vocal cords, caused by some foreign bodies. And foreign body may be anything, whatever you eat, like the piece of meat, piece of egg, or piece of cheese, some object like button, cells, right? Whatever is commonly available in our surrounding, that may act as a foreign body, right? What is the mechanism? Normal mechanism is whenever something enters into the larynx, then there is a protective cough reflex. After coughing, all of us, we expel the foreign body out, right? So this is the protective cough reflex. And in choking, Whenever foreign body enters the larynx, above or below vocal cords, even then there is cough reflex. But in some conditions, cough reflex is depressed. In that situation, the foreign body is not expelled out by our vigorous efforts. Now, what are the different causes of death in choking? Number one, mechanical asphyxia, means asphyxial features are present. That means the foreign body that obstructed the airways, which stopped the entry of air or oxygen into the lungs, right? So in the absence of oxygen, hypoxia or anoxia that developed. And in that situation, we get asphyxial features, right? Like cyanosis, petechial hemorrhages, congestion of face, right? Second cause of death is laryngeal spasm, means the foreign body that irritated the larynx mucosa, laryngeal mucosa, and in that situation, the larynx becomes in spasmodic condition. Here also, the entry of air is prevented by laryngeal spasm. So obviously, in this situation also, we will get asphyxial features. So in both of these, mechanical asphyxia as well as laryngeal spasm, we get asphyxial features. Now, third cause of death is vagal inhibition of heart. That means the foreign body that irritated the laryngeal mucosa, and that irritation stimulated a nerve, recurrent laryngeal nerve. And recurrent laryngeal nerve that goes into the medulla, from where the respiratory and circulatory centers are there. From there, this message, this signal that goes to the heart via the vagus nerve, right? And we know vagus nerve is inhibitory in nature. So if vagus is stimulated, then its action will be inhibition of heart. In that situation, it causes cardiac arrest. Since this vagal inhibition of heart, that is a very rapid process, right? So here asphyxial features are usually absent. Okay, so there are no asphyxial features. Then fourth cause of death may be combination of above three mentioned causes, right? And in this situation, what happens? If foreign body obstructs the airways, it may irritate the airways to cause laryngeal spasm as well as vagal inhibition of heart, as well as it causes mechanical asphyxia. So in this situation, all features may be present or absent. Next, please. Management. What is the management for choking? So obviously, whenever something get obstructed in the airways and you see that person, because that person can't shout, even he may not cough, right? So it's not easy to appreciate that, but we can help him. And that maneuver is known as Heimlich maneuver. You might have heard this maneuver in your ENT books, right? In Heimlich maneuver, the rescuer means the person who rescues the victim, that stands behind the victim, right? And he makes a fist by holding both hands. And at the epigastric region, the pressure, backward and upward pressure is exerted. In this way, some backward thrusts are provided. And due to this backward thrust, the obstructive object, foreign body, that is expelled out. This is known as Heimlich maneuver. But there are some complications also. But in emergency, this can be done. Second is emergency cricothyrotomy or cricothyroidectomy. Here, what is there? Above cricoid cartilage and below laryngeal cartilage, there is a small space. In that space, we can provide a hole, and through that hole, we can insert a pipe, and through that pipe, the person can inhale and exhale. This is done in emergency situations, right? But in operation theater, the ultimate procedure is emergency tracheostomy. Means below the cricoid cartilage, a hole is made in the trachea in which tracheostomy tube is inserted, and that provides a pathway for air entry. So in case of choking, we can do these three things. Now, postmortem findings in choking. As you know very well, in choking, the major cause of death is asphyxia. That means all the features of asphyxia will be well evident here, right? And on postmortem, foreign body may be found in larynx, trachea, or bronchi, right? After opening these airways. Respiratory passage may be congested or edematous at the site of blockage. This is due to laryngeal, or this is due to the irritation of mucosa, right? Next, please. Now, we see medical legal aspects. In most of the cases, choking is usually accidental, right? You might have heard that children, usually children, they ingest something in their mouth, or they put something into their mouth while playing, and when they shout or scream or cry or laugh, then they suffer from this problem. Even laughing or crying or even talking while eating, that may cause this problem. So it is well said that while eating, we should not laugh or even talk. Even eating in drunken state, that may cause this problem, choking. Why? Because in drunken state, the muscles are loose, right? So cough reflex, that is also depressed. And if any food particle that enter the larynx, due to the depressed cough reflex, we can't cough it out. So it enters into the larynx. Sometimes in very old persons, this reflex is very weak. In some sick patients, this reflex is very weak. In some diseases like diphtheria, it can be seen. Sometimes vomitus or stomach content can be regurgitated, right? Like in a comatose patient or during anesthesia, right? So it may enter into the trachea. It may cause choking. Sometimes while doing dental operations, a swab that may obstruct the larynx, or some teeth or any tooth that may obstruct the larynx. And in some cases, there are some drug reactions, like penicillin injection is given without hypersensitive test, right? In that case, there is laryngeal mucosal swelling that may obstruct the airways. And in some insect bite, there are some hypersensitive reactions which may obstruct the airways due to laryngeal mucosal swelling. Choking may be suicidal. Usually choking is accidental, but it may be suicidal, where it is seen mainly in psychiatric patients, right? Who ingest something with the intention to commit suicide. Sometimes it has been seen in custodial patients in custody, and very rarely it may be homicidal. And fourth medical legal aspect is cafe coronary, which we will discuss further. Please change. Now, let's discuss cafe coronary. Actually, this is not a different thing. This is totally associated with the topic of choking, right? As you know, we have discussed 4 causes of death in choking, right? One of that is cafe coronary. So let us discuss here. What happens? a healthy but grossly intoxicated or drunken person. See, one drunken person is sitting in the restaurant or cafe house, right? He begins a meal in hurry, right? He has to go somewhere else, so he starts eating in hurry. Suddenly he turns blue and he collapses and dies rapidly without any further distress. That means unexpectedly, that person who was very well sometimes ago, he suddenly dies. So it appears that he might have died due to coronary artery disease or a myocardial infarction. It appears, right? But it is not so. Here we can say rapid or sudden death due to obstruction of upper airways by impacted food particles has been known popularly as cafe coronary, right? So, in choking, the death is not rapid. Death is slow because it takes some time to it takes some time for a person to die due to absence of oxygen, right? I am saying about pure choking. But in some cases of choking, where rapid death occurs due to obstruction of upper airways due to impacted food particles, that has been popularly known as cafe coronary. So cafe means cafe house, coronary means coronary artery. So previously, it was thought that such deaths they occur due to coronary artery disease, but it's not so. Since these clinical features means suddenness and rapidity of death that mimics an acute heart attack, so this condition is known by the name cafe coronary, right? Next, please. Okay, cause of death in cafe coronary. Why is there sudden death in cafe coronary? There is a term, there is a phrase, reflex vagal inhibition of heart, right? Not coronary occlusion. So what happens is sometimes foreign body that obstruct the airways, subsequently it irritates the laryngeal mucosa. The signal goes to medulla. From there, the signal goes via vagus nerve to the heart, and it causes reflex vagal inhibition of heart, means cardiac arrest. So it causes cardiac arrest suddenly. So there is no time for the absence of oxygen to develop, right? Or anoxia or hypoxia to develop. So death is rapid. This is the cause of death in cafe coronary syndrome. Mechanism: usually very large bolus of unchewed food like meat or cheese that stimulates recurrent laryngeal nerve, a branch of vagus, as we told, to inhibit heart. It causes cardiac arrest. Next, please. Cafe coronary predisposing factor. In old age, unchewed food bolus that may be impacted due to poor dentition, means people who don't have teeth, they may not chew or masticate the food properly. So the bolus of the food is very thick, very large in size. That's why that may obstruct the airways, and even the cough reflex is also weak in old age. Under influence of alcohol, it's a very common factor in such patients. Already cough reflex and gag reflex are suppressed when a person is under the influence of alcohol, right? So such person, if ingest food, so there are more chances to get developed cafe coronary, right? Drugs, some in under the influence of some sedatives or anti-Parkinsonism, this cafe coronary may develop. In some diseases, Alzheimer's disease, Parkinson's disease, or stroke and intellectual disability, means mental retardation, previously known as, right? So these are predisposing factors in cafe coronary. Next, please. Now, autopsy features. As you know, in cafe coronary, the death occurred suddenly due to cardiac arrest. So there is no time for the asphyxial features to develop, right? As seen in choking, classical choking. In classical choking, asphyxial features develop because the foreign body obstructed the airways and it took much time to develop the choking. Means the oxygen entry was prevented and person dies due to suffocation. So it took time to develop the asphyxial features. But in cafe coronary, death was sudden, rapid. So there are no asphyxial features, right? So on autopsy features, we can see a large piece of poorly chewed bolus may be found obstructing the entrance of the larynx. So when we dissect the larynx, we can find a large chewed food. Then signs of choking or asphyxia are often absent because death is instant due to vagal inhibition of heart. Right. Sometimes symptoms of choking may occur first and then death occurs from vagal inhibition. Here the signs of asphyxia may also be present. In this situation, what happens? When a foreign body obstructs the airways, in starting, symptoms of choking, symptoms of asphyxia, they developed, but later on, that irritated the mucosa, and from the mucosa, signal went to medulla. From the medulla, signal went to heart to cause cardiac arrest. So here both we can see the symptoms of asphyxia that may be present, right? Management. Heimlich maneuver, as you know, the same thing, we have to take out the foreign body, right? Or we can apply Heimlich maneuver if the condition detected immediately. And because in such situations, cardiac arrest occurs, so we can save the patient by performing cardiopulmonary resuscitation. So it is also essential here, right? Next, please. Right. So first of all, just revise choking. In choking, asphyxial features develop, right? So it takes time for a person to die. In coronary, cafe coronary, the person dies rapidly or suddenly without any signs of asphyxial features because that death was due to reflex vagal inhibition of heart, right? Now, there is an associated topic here, vagal inhibition of heart. A separate question that is often asked in the exam on choking as well as on cafe coronary and also on vagal inhibition of heart, right? So in the book written by author that contains these three short notes. So you must go through these. So this topic is vagal inhibition of heart. You know vagus nerve. Vagus nerve is the 10th cranial nerve and it has widest distribution. It also longest cranial nerve. It has a widest distribution in the body. So this is also known as wandering nerve, right? And very unpredictable nerve. Its action is inhibitory. How? That means its neurotransmitter is acetylcholine, ACH. Stimulation of vagus nerve that causes the inhibition of heart, right? Inhibition of, stimulation of vagus nerve that causes inhibition of heart. So if vagus is stimulated, the heart is inhibited. So we should say it is vagal inhibition of heart. So here vagus is stimulated and heart is inhibited. Now the afferents coming from periphery of brainstem, periphery to brainstem and then stimulate vagus. We can say on our body and inside different organs, the afferents, they emerge and they go into the medulla, brainstem, right? And different stimuli from these different organs and body surface, they go to the medulla. From there, from medulla, the efferents, they emerge from the medulla to the heart via cardiac branch of vagus nerve, right? So obviously, from these stimulus from the periphery, these circulatory centers, they are stimulated. That's why vagus is stimulated. And when vagus is stimulated, you know very well, it is inhibited in action. So heart is inhibited, right? Okay, next please. Now see, you know, we are all normal persons, and in all normal persons, the afferents coming from some specific regions at periphery of the body, that causes slight decrease of heart rate and slight decrease of BP. So up to how much extent the heart rate is decreased? Less than 6 beats per minute, right? If you have suppose 76 beats per minute, so in this situation, your heart rate decreases to 70, right? Just like that, in BP, the change is of less than 10 millimeter Hg. Okay, this is in normal persons. That means suppose uh, mm, if we put cold water on our head suddenly while bathing, then vagus is stimulated, right? And heart is inhibited. So this inhibition of heart rate or heart, that appears in the form of decrease in heart rate and decrease in BP. So this is the normal range in which a common person that manifests these changes, right? But there are some persons who are very hypersensitive, right? They are hypersensitive to many situations. They are hypersensitive to many trauma, minor trauma, and relatively simple or harmless peripheral stimulation, right? So in these persons, in hypersensitive persons, what happens? The vagus nerve is stimulated very quickly, and ultimately it inhibits heart, cardiac arrest, and within seconds or minutes of peripheral stimulation, death occurs, right? So remember that in normal person, the heart rate decreases by less than 6 beats per minute, and BP decreases by less than 10 millimeter Hg. And this is quite normal in our day-to-day life, right? But in some hypersensitive person, this same thing that occurs at a very severe level, that directly stimulates vagus nerve, that inhibits heart, and it causes death. So here the trauma may be very minor, right? And peripheral stimulation, that may be very simple or harmless. So we will see some examples here also. Next, please. See here. Accidental death. Like a teacher slapped a student and the student died on the spot. You might have heard this news in newspapers, right? The teacher slapped the student, and that was a very casual slap, but the student fell on the ground and died. It may be possible that the little finger of the teacher, that pressurized on the carotid sinus, right, at the lower border of ear, right, and it causes vagal inhibition. Even in mechanical asphyxia, pressure on carotid sinus, like by hands in throttling or by ligature in hanging and strangulation. So in throttling, the pressure is acted on the larynx, and on the larynx, just above that, there is a carotid sinus. So if that is pressed, that leads to vagal inhibition of heart. Even ligature in hanging and strangulation, that also causes that pressure on the carotid sinus. Coronary, we have already discussed it, right? So what happens in coronary? The bolus of the food that irritates laryngeal mucosa. From the laryngeal mucosa, signal goes via the recurrent laryngeal nerve to the medulla. From the medulla, what happens? Heart is inhibited. Okay, then mugging, chokehold or arm choke, in a police custody, or when a offender is running very fast and some police officer personnel that wants to catch him, then he holds him in the arm, in his arm, right? In that situation, this vagal inhibition of heart may occur. In hydrocution means sudden immersion in cold water. Sometimes if a person falls or jumps into cold water, that he may die due to hydrocution. The cause is same, vagal inhibition of heart, cardiac arrest, right? So we should be very careful in these things, and we should know about this. Sudden unexpected blow to the larynx, chest, abdomen, or scrotum, right? Sometime during casual fight, the larynx may be hit, or some a fist may be hit, may be hit on the chest or abdomen, or sometimes testicles or scrotum, they are squeezed by an offender. It may cause sudden unexpected death due to vagal inhibition of heart. Then in some medical checkups, insertion of instruments like bronchus into the bronchus or uterus or cervix or rectum or urinary bladder. When some instrument is inserted, then due to sudden dilatation, the afferents from here, they go to the brainstem, and that may cause sudden reflex vagal inhibition of heart. Sometimes pleural and ascitic tap, which we often do in the medical emergencies, right? So during that also, the person can die due to vagal inhibition of heart. Some emotional factors are also associated, like some young adults of nervous temperaments, that the person who is very sensitive, which has fear or fright or very emotional, right? Even the person who can who sees the blood, slight blood, that may faint down, he may fall on the ground, he may die. Sometimes the person who is getting the needle inserting into the vein to take the blood sample, that may fall on the ground, that may die. And sometimes excessive activation of vagus nerve occurring during emotional stress, that may also cause vagal inhibition of heart and ultimately death. Please change. So we will take classical example of vagal inhibition of heart, and it is in the case of pressure on neck baroreceptor, right? I recall a case. A husband was dancing with his wife, and casually that husband then touched the neck of his wife, and suddenly the wife fell on the ground while dancing, and she was found to be dead. The cause of death was cardiac arrest due to vagal inhibition of heart, right? In this situation, what happens? There is a common carotid artery that divides into internal carotid and external carotid. At the starting or origin of internal carotid artery, there is a carotid sinus. In this carotid sinus, there are some baroreceptors which are very sensitive to the pressure, right? So when pressure is applied here due to some casual trauma or while playing in some hypersensitive people, then from here the signal goes to the brainstem via the hearing nerve. So hearing nerve is carotid sinus nerve, right? So hearing nerve is a branch of ninth cranial nerve, means glossopharyngeal nerve, right? So through glossopharyngeal nerve, it goes to the nucleus tractus solitarius and dorsal motor nucleus of vagus, right? From here, the signal passes through vagus. So stimulation of vagus occurs. So stimulation of vagus causes vagal inhibition of heart, means reflex cardiac arrest. So heart is inhibited here, right? So this diagram is very important, and we should remember it because this can be asked in the exam, and you, all the students, they should draw it in the exam. Next, please. Autopsy finding in vagal inhibition of heart. So, vagal inhibition of heart, the death is sudden due to cardiac arrest. So there are no specific findings at all, right? And other causes of death, they should be excluded by medical checkup, right? And opinion regarding cause of death, that is given on the basis of exclusion of other causes of death, like if there is any natural disease or not, cases of poisoning, we have to exclude these. And in such cases, because cause of death determination is very difficult, so a statement of reliable witness is must, right? And also circumstantial evidence is also of utmost important. So we have to take all these criteria: exclusion of other causes, statement of reliable witness, and circumstantial evidence. On the basis of these, we have to frame our opinion, right? So negative autopsy rates are very high in such cases, right? Next, please. I hope so. You have understood these all three topics: choking, cafe coronary, and vagal inhibition of heart. If there is any query, we will take it. But before that, I must ask three questions. Please change. Hello.
So we have three questions to ask. So to answer the questions, everyone will have to scan the QR code that you can see on the screen. And we have three questions. I'll keep moving the questions once I see a good amount of results in the first question.
Okay, I will read question. Role of reflex vagal inhibition is more in choking, cafe coronary, drowning, traumatic asphyxia. Which is the best suitable answer? Anyone can answer?
Let me show the results also to see if people are answering the questions.
Okay. Yeah, good. This is cafe coronary. Next, please.
Yeah.
In case of cafe coronary, signs of asphyxia are always present, always absent, maybe present, none. It's a tricky question.
Let's see the results though.
Yeah. Yes, maybe present. Wonderful. Good. It's right.
So we have another question.
Alcohol consumption, a risk factor for choking, a risk factor for cafe coronary, not a risk factor for choking as well as cafe coronary. Please see that result.
Yeah.
Very good. risk factor for choking as well as cafe coronary, because cuff reflex is depressed. So that may cause choking as well as cafe coronary. Good. Any question?
So I think we can end the session.
Okay. Right. Thank you very much. Thank you all students. Thank you.
Yeah. Thank you, everyone. Thank you for participating in the session. Have a very good rest of the evening.